Check.
Okay. I won't repeat what I just said. I think I think I'm getting a little bit of feedback, so if people want to just mute while I'm chatting, and then that might help with that feedback, but I don't know if it's just me that hears it. So, I would love to open it up to the board. I don't want to speak for too long without it being a conversation, but so do you want to pull up those documents that you were able to share, and I can just orient the group to them? Or is that going to be something that's tricky for you with the power issue?
I did not pull them up because when my computer crashed, and now I don't want to move, to be honest with you.
Okay.
I did send them to the board though.
Okay, so if you had a chance to look at those documents, really they just talk about how the literature supported that really the mental health services in school are part of student wellness. They're part of the framework of understanding what health and wellness is for our students. And I think recognizing mental health as one part of behavioral health is an important distinction, because I can understand that it might feel like a large continuum to think about all aspects of children's health. And yet, there is more research than we can get our hands on to say that the mental health supports that are currently available by the providers that are in our schools are not sufficient for the need. So if before, when we were wearing sunscreen, and like the sunscreen that we bought at the store was making sure that we wouldn't get sunburned, now we're in Australia and we don't have the right SPF for all of our children under the sun in Australia, which is kind of what's happening to us right now. So we need a wider scope and range of supports. And really, unfortunately, being someone who oversees clinical day schools across the state, and in particular at EastCon, the fact is that students are outplaced to our schools when their districts do not have enough mental health services to support them in the district, and their triangles end too early for the wraparound for those students to be met within district. So we always want to look at what we call the least restrictive environment, or the environment that provides the students with the most amount of time with what we call non-disabled peers. But really the saddest part for me when I see some of our students in our clinical day schools is that what they're being offered is at a large cost to district is just that last tippy top of the triangle where they need some mental health supports that go above and beyond what their public school was offering them. And that's preventing them from continuing to participate in general education, and comes at a pretty substantial cost to the district depending on the outplacement. So that's sort of the pro end, is thinking about it as part of wellness, and at the back end from a responsive level, it's about the students' access to the general education environment and the fiscal impact on the budget. So that's where I'll start, but I'm sure I can touch on some other pieces as questions come up. I'd be happy to field questions if you think that is a good next step.
Let's go through, Ravi, let's go through the questions that they had, and that's why they sent them in. And I think between Marcia and you and myself, we can kind of go through each of those. The first question that was on there was, what are we doing internally regarding mental health services, and what staff do we have to support this? Marcia, do you want to respond to that? Can you unmute Marcia, Catherine, please? There we go.
Thank you. Good evening, everyone. Thanks for having me here tonight. Before I start answering questions, I'd just like to say that I'm really thankful for everyone on this call, because, I think from what I'm hearing tonight is that everyone here really does understand that there is a need for mental health services. And I'm glad that we are continuing this conversation because it is so important. And I think, as we continue this conversation, we don't want to jump to, the outcome yet. We just need to start recognizing that the need is there. And I think that there's different ways that we can solve this issue. So I'm glad that we're talking about this again tonight. So the question that we're starting off with is looking at how we're providing these services in district. Universally, we are providing mental health services for all students through kind of, that social emotional learning that Ravit was talking about, which is embedded into our curriculum. And I'll give two very brief examples. At Hall, we have our advisory where students meet and have discussions. And we also have our morning meetings at Center where that social emotional learning is happening. Another way that we're providing these services is, it's nice to be in a small district. We're very lucky because we get to know our students very well, and our teachers, our related service providers, paras really get to know the students, and they recognize when students, are not having a good day, are just off. So they see the students and they know how to make referrals and how to access mental health services in the schools. They may refer a student for counseling. They may go to a mental health provider just to say, hey, you know what, I want to talk to you about this student. I'm seeing that there's a change in behavior. What can we do? So they know how to access those services. Our counselors are also very active members of multidisciplinary teams, such as our student assistance teams, our special ed teams, 504 teams, grade level teams. That helps the teams to make sure that they have a pulse on their students' mental health. So there's discussions daily in regards to mental health. Our counseling staff, we kind of talked about that a little bit, but just to give a very clear view of who our counselors are, we do have a school psychologist. He is shared through the district, so he does spend part of his time at Center, part of his time at Hall. His role also is very involved with special education, where he's providing assessments. We have a school social worker who is full-time at Center, and then a school counselor who is full-time at Hall. All three counselors provide crisis counseling, individual and group counseling. They are liaisons to community-based services and also liaisons to parents. So I don't know if Phil, there's anything else that you'd like to add to that?
Marcia, do you want to talk? So do you want to talk about just the people that you just named? I think it's important for the board to have a sense of, is that just their job? Are they just counseling? And it may vary for each person. You want to just touch on that real quick?
Yeah, that, the counseling is just a piece of their job. Like I said, they are involved in multidisciplinary team meetings. Alan Rose, our school psychologist, he is heavily involved with our special ed team where he's providing assessments like I was talking about. He assesses our students who are being referred initially for special education. He's also assessing students who are required to have their triennial every 3 years. They are required to be reassessed for special education services. So that is a role that he has. Kim Talona is our school counselor. She also plays a very active role in preparing our students for high school, that high school transition. So there's certainly many other roles and functions that they play, throughout their day. So counseling is just one small piece.
It's one hat. Okay. The next question that was on there are private providers available in the area, and are they taking new patients? Dr. Stein, do you have a sense on what's out there? The type of providers, are they, for students? Are they for adults? What's out there?
So there's a lot of providers in Connecticut, but the number of providers in our area of the state is extremely, extremely limited. And the number of providers that see students under the age of 14 is just a small sliver of that. So there was a parent earlier in the call who mentioned that wait lists are long, and I just wanted to reflect that is my experience as someone who is often connecting with schools and looking for providers for students outside of schools. There are very few in our area. If you go on somewhere like Psychology Today, where you can, or you go on your Cigna or Aetna or whatever, and you look for providers via insurance, There will be names of people who provide services, but the likelihood that they're actually people who trained to work with adolescents and children is very, very low. And so there's a difference between someone who's licensed to work with students and someone who is actually an expert in working with students of the age range of, pre-K through 8, as is the Willington School District. So I don't have even 5 providers out the top of my head that I would name based on my experience in the last 10 or 15 years that I really feel confident that if my own child needed services that I would want to give that name. And so, and the ones that I do know of do have wait lists. So that's my own experience. I'll give that caveat. That's not to say that there are not providers in the area, but to speak to if you're in a situation where you want to send your own child to someone, you want to feel confident that that provider is well equipped to be a good fit for your child.
Marcia, do you want to speak to the next question? How does mental health services during the school day impact the student's day, and just kind of that balance of on-site versus off-site?
Sure. I want to start just kind of by thinking about this in a broader view. And, somebody on this call kind of brought this to my attention a few days ago, just about accessibility. We want to decrease disparity by increasing accessibility. I, as Director of Pupil Services, I spend my days thinking about how we can best serve our students with disabilities to make sure that we're increasing accessibility and access to the curriculum. We do that by providing specialized instruction and accommodations and modifications. Another example that was brought to my attention is for students who receive free and reduced lunch. We offer that because we want to increase their accessibility to healthy food. Looking at school-based mental health services, we're increasing their accessibility to health, which allows students, and studies will show, allows students to have increased time in school, increased school engagement. They are leaving school less to have to go to appointments. I have seen some students who will have to be out of school for a day just because they don't have that transportation to be coming back and forth, or they can only get an appointment at 1 o'clock. So they're having to leave early and missing some very important instruction. For some students, that happens on a weekly basis because these appointments happen weekly. So we're increasing student engagement. Some other barriers that we need to think about is the health insurance. Some families don't have that health insurance, or they are very limited to providers because their health insurance only allows them to see certain providers. So we're increasing accessibility by allowing students to be provided that mental health service within the school. As I talked about, transportation is an issue. Some providers will have a wait list, a very long wait list to get in. Let's see.
Marcia, if I can just
Sure.
interject, I don't know if this will lighten the mood or not, but just to talk about access for a minute, I think about like all of our habits as adults. Like in the pandemic, we obviously wanted to have as much touchless contact as possible. But in general, if we think about before the pandemic, there were times where, at least in my family, if I want to order dinner and there's some place that I really like and I have to go pick it up from that place, but there's another place whose pizza is like not as good, but they deliver, like I'm going to get the pizza delivered some nights because the access is higher, even if it wasn't where I exactly wanted to go. Or I might just, do some running on my street instead of going to the gym because the access to the gym requires more what we call in our behavioral terms response effort. So I just wanted you guys to think about times in your own lives where like the access to something prevented you from doing it as regularly as you like. I love, love, love to swim. It's my favorite sport, but I don't get to the MCC pool nearly as much as I'd like, because it's a process to access that versus just, doing a yoga video at home or just maybe, walking around the block. And so I think it's important for us to reflect on our own access and recognize the ways in which access impacts our own behavior and the way we take care of our health. And that might be worthwhile in considering when you're thinking about students and their own health. I know that people have actually increased their use of mental health services during COVID because telehealth has become something that has allowed people to increase their access and be willing to see a provider from the comfort and privacy of their own home. And so I just want to go from that perspective of access. That obviously is relevant for students that could see someone in telehealth at home instead of seeing them, but it would require internet access. It would require regular ability for their parent to help them log on. And so again, I think that when we're talking about disparities and equity, that access piece is just so central to the conversation. So that's my real world analogy on what Marcia was talking about related to access.
I'd also like to add one other piece too. Ravit talked about the whole child, and it is so important for the child's providers to have communication and work together as a team. And when the schools can work with the mental health providers, with the parents, you're going to have so much stronger results for the student. And to me, that is such an important piece because it has to all come together. Otherwise, we are sending mixed messages possibly. We are sharing different information with the child. So when you have that work and when you're working together as that multidisciplinary team for that student, it really comes together and provides nice continuity of service. So that I think is another important piece to address when we're talking about mental health and how we bring it all together for the students.
Dr. Stein talked about the triangle, and the bottom of that triangle is really the everyone, right? And Marcia talked about the students taking part, and all students taking part in an advisory or morning meeting, and then the level of support kind of goes up from there. And that top peak of the triangle is what Dr. Stein was talking about, with a smaller number of students needing a higher level of service. Marcia, can you talk about what's going to prompt a teacher to get there? That was one of the questions from the board. What's going to prompt services, walk through the process and get to that point?
Sure. Well, as I talked about earlier, our staff really know how to access services. So I have, kind of want to go through just some examples of reasons why they would access those services. One of the top reasons is, a student in crisis. Students having an emotional outburst or is emotionally dysregulated. Maybe there's suicide ideation, self-injurious behavior, disclosure of abuse or neglect. That is something that would, a referral would be made immediately to one of our counselors. Some other reasons: change in students' behavior. Student is acting withdrawn, appears sad or upset. Definitely that teacher would be reaching out to one of our counselors. We also provide counseling for lack of educational engagement. Students who have poor work completion, attendance issues, maybe negative outlook on school achievement. They're just not engaged. That could make a referral for services. We also provide services to students who have relationship conflicts with peers or adults. Certainly, counseling is provided around any type of situation that is related to bullying, whether it is, what we call the victim of bullying, or maybe, a student who is in a different role. We provide counseling for students with low self-esteem, low self-confidence. Self-advocacy skills are some goals that our counselors work on with many of our students. We also provide counseling around executive functioning, skill development, organization, how do they organize and manage their day. We provide counseling for issues around things even out of school that are impacting their school performance. So there might be something going on in the community that's, upsetting them, that's really impeding them to be engaged. Then a counselor may get involved to help support them. I think we're going to talk a little bit later about, parent permission and what that looks like, because I'm sure that is a question. So I'll hold off a little bit and talk about that further down the line.
I think it's the other piece, and I've experienced this obviously as a superintendent and a principal. When you have a student that's in crisis, there's only a certain level that our staff can do. And Marcia, you can chime in on this. One of the things that we do when a student's in crisis is we have an obligation to call 211 or the mobile psych unit. And one of the things about having that an additional service or person in the building, they may have the capacity for us not to have to do that. Am I understanding that correct, Marcia?
Yes, our counselors assess students' level of need, and they do that in conjunction with the parents and working with the parents. And there are times that they do access community-based services like mobile crisis that usually, would be a student who is in crisis and needs immediate attention. So they would be the ones that would help the family be able to navigate that. So am I answering your question, Phil?
Yeah. I just think, it's one of those things that when we call 211, and I see Donna, your hand, when we call 211, we get the mobile psych unit, is it a snap of the finger? And I think was my perception as a principal was, we'd make the call and expect that somebody within 20 minutes to be there. And sometimes that 20 minutes was not realistic. It was more like hours. And so, they're all over. So it's not like you have that service. Yes, it's out there. You can call and you need permission for a student to talk to the mobile psych unit, correct? From the parents. We would need that. But there are times where for that student to safely re-enter school, there needs to be some sort of evaluation. And so we're talking about, again, the tippy top of that triangle where the needs are really, really extreme. Donna, you had a question?
Just for a frame of reference, how many times in a school year, so let's go like last year from September to June, did you have to call 211?
I don't have numbers. I will say that 211 was accessed last year, but I don't really have numbers.
A rough range, are we talking 10 or less? Are we talking 100? I have no frame of reference.
Yeah, no, I would say 10 or less.
Okay,
there is definitely a good amount of support and assessment that goes in before 211 is called. That's usually the highest level of service where a student is just really cannot dysregulate and needs immediate services as immediate as they can provide. So that is really that highest level of service that Phil's been talking about on that triangle.
And the other piece of
call typically results in a hospitalization.
I was just going to say that.
Yeah, just so like there's a pretty big jump from like school psych services to a 211 call. And I think that 10 or less 211 calls a year is probably average for most districts in this area, because that's going to be a situation where after that student might be committed to an inpatient unit as a result of that call. So I just wanted to make sure that people can see that the need for mental health supports regularly and the need for a 211 call, that there's like a gap in between those two things.
Could you just explain what dysregulation? I don't understand the term. And so
I can speak to that a little bit. It's when a student is unsafe with themselves or others in the building, which means that they may be aggressing at a frequency or intensity at staff or other students in a manner where we cannot keep ourselves or the students safe using our protective management techniques or other de-escalation strategies that we as professionals have been taught, or the student is making statements that are of concern in terms of the likelihood that they would hurt themselves or others, or making threats that that basically we don't feel like we can keep that student and or their peers safe.
Okay.
Marcia, does that cover the general?
Yep.
That does, definitely. Mhm.
Okay.
And just to give a little background too on 211, the mobile crisis unit, that was started, I don't know when it was started, but that was started because they're trying to keep students or kids from having to go directly to an emergency room. So there's a trained crisis counselor that comes out and does that assessment and then makes a determination what the next steps would be. So that's to try to prevent, that immediate, going right to the emergency room.
So, Dr. Stein, without going to that level, can you just talk about typical mental health support? What's that professional going to provide? What's that health clinician going to provide? What services? And then what are they not going to provide? What would that week look like? And Marcia mentioned every week. The example I just gave is, again, the peak of that triangle, but we're really below that. And so those on a regular basis, what types of services would they?
I think I want to start actually, and tell me if I'm going too far on a tangent, but I think I want to start actually by putting my school psychologist hat on, because I'm a school psychologist by training, and school psychologists are not licensed psychologists. They can be, but they often are not. They're most often master's level psychologists who have had 3 years of training, so one more year from beyond a social worker but their role is to be what we call a generalist. They have to know a little bit about almost everything that could happen to a child or adolescent between the ages of 3 and 21. And so we are bound by something called ed benefit, which means that when school psychologists are participating in supports in a school, they are typically involved with students who have what we call IEP mandated counseling. And that counseling has to have what we call educational benefit, which means that the scope of the role that I can play if I'm a school psychologist in a school has to be within the bounds of what would be connected to their IEP and would connect to educational benefit. So if I'm working on some social skills with that student, that allows me to work with them regularly, but because when their social skills get better, they can more often spend time with their peers and be in general education for more hours of the day, which is the goal, so that they can increase their educational achievement by participating with their peers. I cannot, in my role as a school psychologist, do carte blanche counseling with a child because they need it, because it's not within the framework of ed benefit. So it's really important to recognize that while your school has a school psychologist that is district-wide to cover on average 1,000 students or 200 students or 500 students, they function as a generalist. They're like your triage team in the ER. And they might be able to do a little bit of support, but on the educational side, when a student has a reading disability and their reading is in the first or second percentile, your district offers reading support for an hour a day, every single day, to get them back up to where they would need to be or try to close the gap. On the school psych side, if we have a student who's in the first or second percentile from a social skills perspective, we do not have the framework in schools for that school psychologist to see that kid an hour a day. So we're addressing a student's educational needs from an academic perspective when they're in the first percentile, but we have a mental health need that's in the first or second or fifth percentile, that tippy top of the triangle. And the ability of your school psychologist to offer the level of service that your reading specialist offers is just not apples to apples. So when a counselor or clinician that is a mental health provider that has a wider ability to access and work with students more regularly, instead of that provider being in the community, it supports that student being able to make those gains more quickly and be able to more likely access their education more often. Because those students that are at the tippy top of the triangle don't get to spend as much time with their peers because of that dysregulation. They end up spending time in rooms alone. They end up having case managers and lots of building resources allocated to them instead of being able to be out with their peers, because the school psychologist can't cover that need. So we're just talking about the in-between of the outplacement, where all children in those outplacements have a clinician that does what would be done in your school with parent permission, which is check in with that child daily, potentially if needed. Just be available to connect more regularly with the classroom teacher about what are the supports that can keep that child in class and support them. And then also figure out what other needs in the community could be available to bring that child's health, their mental health status to sort of the place where they can be most connected to their peers in their community. So that's the connection that I can make, is that when a child gets outplaced, what do we offer them in that outplacement setting? We offer them more regular support to a clinical team that works closely with their educational teacher to make sure that they can be more successful in that environment.
Thanks. Marcia, do you want to briefly speak to cost? And when we speak to cost, we were kind of limited to the question of, I think from Laura, who's a newer board member, just to the school-based health center.
Sure. In regards to the school-based health center, the cost, there is no cost to the district for a school-based health center. The only requirement that they would have is that they have a place. They have a phone, they have internet. So there is no cost to the district. If we're talking about mental health and being able to provide the necessary mental health services for our students, if we needed to hire another mental health, there would be an additional cost for that. But for the school-based health center, there is no cost.
Do you want to talk?
Yep.
Go ahead. Oh, sorry, Laura's muted. Can you unmute Laura? I didn't see her, sorry, thank you.
We can't hear.
It's not me, I swear.
Okay, well, I tried, it didn't unmute the first time. Thank you. One question I had as far as cost, and you just went into the whole cost thing. So thank you for that. But I was also wondering, when you call 211, is there a cost associated to the school in that service? And then if the student does end up being placed inpatient, is there a cost associated with that to the school, or are those covered by parents or insurance or something?
Yes, that would be covered by parents or insurance. The cost of the district is kind of, more so what Dr. Stein was talking about, that if we're not able to provide those services in district, then we have to look towards other places that can provide those services, such as looking into outplacement. So there is a cost there, so that would be the majority of the cost. But no, if they're going to hospitalization, that would be the parents' insurance.
What if the parents didn't have insurance?
Then that would be the program, the hospital working with the parents. So there would be no educational cost for that.
Thank you.
Average outplacement cost, Marcia?
100,000.
Do you want to talk about
transportation?
Yeah, without transportation, that's true. Yeah.
Yeah, with transportation, we're looking at 150,000 potentially. Some places are certainly higher than that. And it all depends also sometimes on the exact services that the students need. So it is, if a student has counseling services, there's additional cost. If a student has OT services, there's additional costs. So it also goes by, what the student needs.
Can you two kind of tag team and Ravi, I think you were kind of talking about this earlier, and Marcia, you did as well. just the parental permission of what's included, and is it ongoing, and the communication, and what's not included. Can you talk about that? The board was interested in that.
Yes, so I will talk about first our parent permission in regards to our current providers. If a student is in crisis, certainly we are going to provide mental health services immediately to them. We would then, be contacting the parent while that's happening. But if we're going to be providing ongoing counseling, then we are required to have parent permission. Parent permission could come in different ways. If a student has an IEP through special education and individual education plan, and it's recommended in their IEP, then the family agrees to the counseling that way. Same as if they are receiving 504 services, if counseling is in their 504, the parent would be agreeing to the counseling through that 504 meeting. If it is a student who receives regular education services, then there would be communication with the counselors to the parent to obtain parent permission. I think it's important to note also that parents can refer students for counseling in the district. And that is happening. That is currently happening. I will say that one of our counselors already has had 5 referrals made by parents. So parents are requesting and accessing the service that we have. So parent permission is required. If we were looking at parent permission through a school-based health center, it would be no different than if you walked into a medical provider, a mental health provider. You would be providing them with the same intake information as you would for any community-based provider. There's probably even more so the needs for parent permission. It is, they have to obtain parent permission in writing. There has to be communication with the parent before they can provide any type of service. They cannot communicate with school staff unless they have parent permission. So there is quite a process for anybody who's accessing school-based health services. And it's very outlined in the services that they can provide. If they are providing mental health services, then they are requesting permission for just mental health services. They cannot then, look at providing other services without parent permission. So that is the process is the same as if you'd be going to any provider in the community.
Do you want to add anything to that, Dr. Stein?
I think you covered most of it, Marcia. Is there anything else you wanted me to speak to on that front?
I don't think so.
No, I think the only thing, go ahead, Laura.
I was going to say, so it sounds to me from that the only situation where that you would be providing services without parent permission would be immediately when a child is in crisis, as you are then also trying to contact the parents and then get their permission. Anything going from there would have to have parent permission.
Correct. Yeah, I think the only other thing I wanted to add is that the consent is very, very clear and comprehensive in terms of what we can and can't talk about with the child, and that at any point parents can always revoke consent. It's not like once they give consent it's over. So and the consent only lasts for 1 year, and again, like Marcia said, there's like a duty to no harm. So we only can provide any kind of support in a crisis situation if a child is a danger to themselves or others. Otherwise, parents must be immediately notified.
I think it's important also to note, as a counselor, you have your code of ethics that you follow. And when you're working with children, anybody under 18, it is kind of your ethical obligation to be including parents in that process. Of course, when a counselor sees a student, they want to provide confidentiality for that student so that student can talk open and freely. But there has to be communication between the provider and the parent in order to provide successful, counseling services. It's so important to make sure, and I said this earlier, that the counselor is working as part of one of the team members that surrounds that child. So I think it's important to note that.
I'm sorry, this is Elena Testa. I'm on the phone. I have no idea how to notify you that I have a question. So can I ask something?
Yeah,
Hello?
definitely. Yes, go ahead.
Yeah, I'm sorry. So I have a question about confidentiality, students' confidentiality. So as I understand that parents would sign a year-long parental consent, and after that, those services are not obligated to notify parents on what's going on or what's wrong with their child. If the child says, we'll say 8 to 9 years old child, if he would say, oh, I don't want my mommy and daddy to know, then mommy and daddy will never know. That's my question. That's number one question, child's confidentiality. And my number two question is, those services, are they obligated, if they are officially obligated, to update parents on every question, on every problem which was revealed about the child? So how much parents are involved officially? Those are my two questions. If anybody could answer, I would
Sure,
appreciate it.
This is Dr. Stein. I can start there. So before working at EastCon, I served in a private practice framework where I saw children and adolescents in a private practice office. And it is the ethical obligation of every clinician to include the family in the conversation on an ongoing basis. So I can only speak to my practice, but I can tell you that I was trained in a very similar way to clinicians that I can imagine. And that is that after every session, or after at least every 2 sessions, the last 10 or 15 minutes of the session was with the parent, if not the entire session. Now, if the child is at school and the parent is not there, it is still my ethical obligation to connect with the parent extremely regularly regarding the child's progress. I would work with that parent from the outset around what are the goals of the support that I'm providing. So if the parent is the best expert on their child, every parent knows their child better than I ever will. And so I need the parent to be my co-leader in the process. And I wouldn't even begin to work with the child before I sat down with the parent and said, what do you wish your child could do that they're not able to do right now? Is it that you wish they could focus better? Is it that you wish that their anxiety didn't get in the way of their ability to spend time with friends or do their schoolwork or something else? But it's, to me, the parent is my partner in the process. And so it's not to my benefit to not include the parent all the time. If not every week to check in to let them know how things are going, then at least bi-weekly. And as parents, if you consent to your child participating in this, in mental health supports, that is the expectation and the understanding of all clinicians, that parents are the partner in the process and would always be involved in the decision making throughout. That's the best way
my concern is, so first of all, as I understand, I'm sorry because we lost power, so I missed your introduction clearly. You do not belong particularly to that company, to health and mental service.
So I'm a psychologist with EastCon, and EastCon is a regional education service center in the region. So we don't provide any school-based mental health supports. I'm just a psychologist by training, and I consult to school districts on the continuum of mental health supports for all students and throughout the triangle.
Yeah, thank you. So my question is, so do we have any representative from that particular company which is trying to get into our school system, or we don't have those representatives? That's number one. Again, how much? My question about child's confidentiality desire from parents. How much that desire is honored for the 9-10 years old child? And also if we have any representatives from that particular company tonight.
I'll let the district discuss. My understanding is that there's no representatives from that
Correct.
company on the line. But just to go back to your question about the child's wish for confidentiality. So if a 9 or 10-year-old says something that is not of concern in terms of a danger to self or others, like I'm nervous about taking tests and I don't want my mom to know that I'm nervous. I think that we would work through with that child why they were fearful of that, and overall spend time trying to work with that child around how to bring their family into the conversation so that their parents can help them. The exception to that is if they said to me, my stepfather is hurting me, in which case I'm still going to break confidentiality because I'm going to call DCF. I'm mandated by law to call DCF and tell them that the child told me that their stepfather was hurting them, and DCF has to take it from there. So either way, I break confidentiality. In the first way, I think through how can I help this child find their parent to be a partner so that we can all work as a team.
Thank you.
Just real quick, Tracy, I see your hand. So the concept of tonight was just without having this specific agency here, and Herb and I had talked about having an expert either from the State Department of Ed or a mental health professional, which obviously Dr. Stein is, to come in and answer questions that were general around mental health and not necessarily specific to that program. And so, if you want to hear more from that program, that could be in the future. And some of the questions that you had can still be pushed into the future. And I'll get to those in a minute, but I know that, Tracy, you had your hand up.
Yes, Tracy Anderson. So my question is about, earlier you mentioned, Dr. Stein, or that you, as a counselor in the school, they can only provide educationally based benefits when it's related to an IEP. How is that different for parents who are asking or are referring their students right now to Marcia and asking for services? What kind of services can they provide that's different than the IEP related?
That's a great question. So different districts, so school psychologists aren't like just on the special ed side or just on the general ed side. They are across the continuum, and they do serve students that are what's called not mandated counseling. It just means that they provide counseling, again, with consent from parents, to students who are not identified as students who have a disability. But different districts have different amounts of time that they've allocated to their school psychologists or counselors for students who are not mandated for counseling. So I'll defer to Marcia on what Willington has in terms of resources for counseling for students who are not identified as students with special needs.
Yes, so Mr. Rose, our school psychologist, his caseload of students he sees primarily receive IEP 504 counseling. Our school social worker and our school counselor also see students who receive IEP and 504 counseling, but they, in addition, are available to provide counseling supports to students who don't have 504 or regular IEP special education plans. You know, they are providing counseling services to support the student so they can have access to their education, so their mental health doesn't impede their access to their education. But they do have limits on what they can provide. You know, they are not family-based therapists. They don't have the access to the families like somebody maybe in the community would, or a school-based health center would. They are not providing a higher level of counseling to address, more higher level needs of depression or anxiety. So there are different levels of service that, non-school-based mental health providers are able to provide.
Okay, thank you.
Donna has her hand up.
As a follow-up to Tracy's question about how many hours a week total, because you're dealing with 3 different individuals, do they have available to deal with the non-504 IEP special needs counseling?
I don't have an exact number for you, but I can say that their caseloads are extremely high. And there are days that if they have students in crisis, of course, those students' needs need to be met first. And there are days that they are not seeing some students on their regular caseload because they are, having to be available for students in crisis. I know our school counselor at Hall has a very full caseload. She doesn't have many opportunities in her day to, add on more students. Mr. Rose is heavily involved with doing the assessments, so his caseload is a little bit smaller to see students for counseling. And our school social worker at Center, the same. She has quite a full caseload of students. Plus, she also tries to support just some families with, family needs and access to services in the community. So their caseloads are very high, and that's one of the reasons why, the administration team initially started looking into how can we increase our services for our students, because we want to be able to provide and make sure that we have accessibility available for all of our students, which is becoming more and more challenging. And that's probably the biggest takeaway from today, is the needs are increasing and we're struggling with trying to meet those needs.
Could you get a rough idea of hours and just let Phil know so he can let us know, please?
I'd be happy to.
Thank you.
Ann, can you unmute Ann, please?
He's not unmuted yet.
Still muted, Ann.
Can you hear me now?
Yep.
Okay. Marcia, that was a great lead up to my question. I actually have 2 questions, but question number 1, what would be the cost if we decided to take on one more counselor, one more mental health provider into our school district to meet all of these needs that we've been talking about tonight? What would be the cost if we paid for another salary and health insurance?
You're close to $100,000.
Okay, very good. Thank you. My second question was, you talked about all the different ways a child could be referred by the teacher, by the parent. Also, am I correct that children can self-refer if they're having some?
Sorry. Yes, absolutely. I'm glad that you mentioned that, because I neglected to say that, but students can self-refer, and we are seeing that in the middle school as they get older. One piece that our counselors are very active in doing is making sure that the students know who they are. As students get older, we want them to be able to advocate for themselves and know how to access resources. So one thing that Kim Talona does is she makes sure that she meets with every student in the middle school at least once a year. So they, they know who she is, they know how to access her, and then in turn they do access. We even talked about how do we make sure students can have that access during this time of COVID when they just cannot move throughout the building like they used to. So she has made herself available and make sure that some students are aware that they can email her as a means of reaching out to her and gain that access. Our counseling staff have been meeting on a regular basis. They're using some of our PD time also to really collaborate to try to come up with some creative ways to make sure that they are accessible for all students. I believe that you'll probably see some new additions to the website in the upcoming months, how to access more counseling services. So I'm very proud of the work that they've been doing to try to address these new issues that we're dealing with in this time of COVID.
Marcia, if a student self-refers, where's the parent kind of sign off at that point?
Yep, that's a good question. So if a student comes down and they self-refer, of course, you know, our counselors are going to want to be available to them, but they will reach out and get parent permission. As a counselor myself, I've had those experiences, and I've had some students come down and say, I really don't want my mom or dad or somebody to know that I am coming down to see you. And that is, that's where we counselors work very hard to help that student feel comfortable in reaching out to the parent, because as I said earlier, it's so important to have the parent involved in this process. It's really a requirement to have that parent involved.
So I just want to make sure I'm clear on this. So, you know, we're speaking right now to our staff. One of the things that I remember, and I want to make sure I'm clear about this, is that when CHC came through, one of the things they said was they wouldn't even talk to a student without that. So a student couldn't refer to that type of agency, but a student could self-refer to one of our staff. Is that correct?
That's correct. Really, you know, if we had a school-based health center in our district, we would have a very clear referral process, and those referrals would primarily come from our counselors. They would, you know, have a clear guidance on how to make those referrals. So students wouldn't be referring, teachers wouldn't be referring. It would be our counselors referring or parents referring.
Okay. I know there was several other questions, and I want to make sure while Dr. Stein's here tonight, in cautious of time, it's 7:45. The board had mentioned several other things, and I just want to fly through a few if that's okay. There was a question, could we talk to Stafford? We have not done that yet because that was a specific question about the community-based health center, which is not really the intent of tonight. It was really about just some general mental health things. We can do that if the board wants to do it in the future. There was a question about, is this opposition to service in particular this service, or is it just mental health in general? I think that's a board discussion kind of in the next point in the agenda. There was a question about hearing from teachers, and that may, again, make more sense at another meeting because I didn't invite any teachers. I knew that Dr. Stein was going to be here tonight. There was a question about policy. Can we open ourselves up to any nonprofit? In our policy 1330, first line says, in accordance with Connecticut general statutes, the Board of Education may permit the use of school facilities for nonprofit educational or community purposes, whether or not school's in session. And the point that Donna has brought up on items in the regulations in item 17 is that the use of school premises for non-school activities is not permitted during the school hour. Violation of these restrictions may result in permanent revocation of the privilege to use school facilities again. And I think the intent of that one is, if rec was supposed to use it from 3 to 5 p.m. and they used their fobs to come in from 7 to 11, they would not be allowed to come back in. But I think what we'd have to do is go back into statute. That again is specific to an outside agency that the board, again, a nonprofit, that the board would want to bring in. We would have to, I would think, write more policy if you brought that type of agency in, though. There was a question about potentially surveying our families, which we could do in the future. And then there were questions about that were added in there about what is the Connecticut State Department of Education and Connecticut Association of Boards of Education. What is their stand on this? Department of Public Health has a whole section on their page, which is connected to community-based health centers. And we can bring you more details about that. And CABLE also has a statement around basically partnerships with to connect children and families to comprehensive services, whatever are needed. So both agencies have statements around those things. Those are kind of, I flew through the end of what's in the questions because I wanted to make sure the board had a chance kind of in the next point of the agenda to have some discussion, but also to ask Dr. Stein questions because she's here. I could ask Marcia to come back, but I've extended. I don't want to push my luck with Dr. Stein. So if you have any other questions from her about mental health supports in general or specific to what she knows about community-based health centers, I think now is probably a good time for that.
I saw Kirsty had her hand up. The one.
Yeah, we can't have a.
Oh, okay. I wasn't sure.
Yeah,
I'm not familiar.
she'll have to wait.
Okay, no problem.
It's okay. Any other board questions? And Elena, I can't see you, so I'm just yell if you want to jump in.
Yes, I'm okay now. Thank you.
Okay. Donna's got a question.
Are you aware of any mental health service providers that are not connected with any kind of medical group or medical provider?
I understand. Yeah.
So somebody that does the mental health piece, but they also don't have a branch or a related company
that does the
medical.
No, that's a very good question. Off the top of my head, I'm not that familiar, but I would just have to defer to Marcia or Phil on that one.
Yeah, I don't know that answer.
I could answer that a little bit. This might not totally answer your question, but just to give some information that I have. So Department of Public Health offers school-based health centers. Some of their sites are full sites. Some of them have health, dental, mental health. They also have an extension of their program, which is called an expanded school-based health center, which only provides mental health services. There's no access to health services. So I'm not sure if that really answers your question, but that's just a piece that I know Department of Public Health offers.
Thank you.
So Herb, I don't know if you want to, I guess there's a couple things here. I don't know if you want to move to the next point in the agenda for board discussion. If people want to soak it in, you know, I have a few things on that the board mentioned as far as next steps that could be, you know, do you want to have that agency come back in? Do you want to have someone from Stafford who has that agency? Do you want us to get some information from them? And also Ashford, because Ashford's using them as well. Do you want to hear from teachers? And then you have this on your agenda for Tuesday night again?
Yes.
So if there's more questions that come up in the meantime, we can collect some more data. Donna, we wrote down a couple of your questions around the number of hours per week, things like that. Do you want to have some discussion now, Herb, with the board?
Yeah, we could have some discussion. Might be a few questions that everyone would like to ask, or maybe they want to make a statement. Can we move to the next agenda item?
Yep, so that's
under
discussion.
old business?
Yes.
Okay, discussion.
Yep, Tracy has her hand up.
I'm happy to stay on the line as long as you'd like, but I also just want to respect the privacy of the board if they want to have discussions without me here. So it's really up to you.
No, our meetings are open.
Oh, okay. Sorry.
The public's
I'll
listening.
stay then.
So you're good.
Tracy had her hand up, Herb.
Do we have a list of topics that would be involved in counseling? I mean, you mentioned a few of them, but it could be almost anything, couldn't it? In other words, anything that the student has a problem with would be open season as far as the counselor is concerned. Is that an issue at all in some cases? In other words, there may be some topics that a parent may not want their student to be involved with if it was a third party.
Marcia or Dr. Stein, do you have a thought on that?
I think my first thought is just that same framework of like working with that student to figure out how to bridge the gap with their parent so that their parent, who is, you know, we all of us who are parents, like want everything for our children. And so the role of the clinician is just to figure out how to bridge the gap, because that clinician can't be there for that child. They need to figure out how to bridge the gap with the family so that the family can be there for the child. So it's really about understanding the problem and then working with that child to figure out how they will access the family as a resource long-term.
And if we're talking about a school-based health center, at intake, you know, they're going to be really looking towards what kind of goals they're going to be working on with that student, and that those goals are going to be developed with the family. So, you know, and if those goals need to be changed, there would be discussion with the family. So I think, you know, that conversation is, and really needs to happen and would happen through that process.
But when you counsel a student during the day, you don't automatically call a parent and tell the parent what you were counseling the student on at all.
No, but I think that
I mean, you couldn't possibly do that.
Yeah, we wouldn't do it every day, but I think there's usually like a preset framework of, we're going to have a bi-weekly phone call to check in about the things that I'm chatting about with your child. And I can let you know that if something comes up in a session that is concerning, I won't wait bi-weekly to call you. I will call you right away. But if we're working on that child's anxiety, and today it was about anxiety in math class, and tomorrow it's about an English class, we'll continue to close the loop together at the end of every week or at the end of every other week, depending on what the family's comfortable with the understanding that if something out of the ordinary comes up, there would be a call right at the end of the session.
Well, you may do that, but we don't know whether the CDC will do that. Will any?
That's a valid point.
Yeah.
Jericho, I think that's
I mean, that's,
but I think that we always have to be cognizant of the legal and ethical obligations of our clinicians, and have faith in, just like our doctors and nurses and our teachers in our society, set expectations about what care should look like, and ensure that the people that are providing that care meet with the expectations that we, as the community that is bringing to them, is saying, this is what we expect of our providers. If you want to be a provider in our community, this is what we expect of you, and this is what we expect of all clinicians that participate in this mental health center.
And just as in any...
The other question I have is in regard to to policy or warranties or liability. It may be out of your field right now. We'd have to deal with the company itself, but what kind of legal provisions do we have to apply in this case? If we have a nonprofit coming in to our district, coming into our school, what is our liability? What are we faced with as far as disclosure things and legal provisions and things of that kind? We need information on that, I think. I don't think, Dr. Stein, you probably have.
No, I would defer
that on
to
tip of your tongue,
You don't have a legal hat, Dr. Stein?
That's something else that we'll hash out.
Yeah, Herb, I think that the thing to remember for us is that we wouldn't be the first. There are many, if we were to do a community-based health center in district that was just around mental health, we would be in the norm. There's a lot of places that already have this, that have already established the legal expectations. And, you know, a lot of it comes right through DPH, through Department of Public Health. So I think that
a good many of those, Phil, a good many of them are in some of the larger schools, I think. I mean, we have a small school. Our school population is very limited. And how many people do we need to service? Not that we don't have to have, you know, this type of service, but what is the maximum number per pupil, for example, needs in our case?
Department of Public Health is now serving 27 communities. That's just through the Department of Public Health. And I will say that just in our area, some of the districts that have school-based health centers that would be similar to ours would be Ashford, Chaplin, Hampton, Scotland, Putnam, Stafford, a little bit larger. But just, just to name a few districts who are closer to us in population that currently have school-based health centers. So there, it is.
The town has it or the school has it?
I'm sorry?
The in-school services on the list that they provided us with doesn't have any of those towns listed. So it might be
No.
that they have an outplacement in the town somewhere, but not in the school.
No, I'm just naming off a few. So there's different providers that could support districts with school-based health centers. So some of those, like for example, Putnam goes through Generations Healthcare. Chaplin, Hampton, Scotland goes through Department of Public Health. Stafford goes through Community Health Centers. So there's different agencies that provide school-based health support.
The one that we're dealing with, though, doesn't have any of those districts. I've got them right in front of me here.
Stafford,
Yeah.
I have Stafford and Ashford.
Yep. Any other?
Are there any other board members that have questions at all they'd like to ask?
Tracy has her hand up. Tracy.
Okay, Tracy Anderson, my question, Marcia, I can't remember back to the meeting in March, but I seem to remember that there were other school-based health clinics that you had looked into. So my question is, I think that, could you tell us about some of the others and also why you chose, or the group that was discussing it chose to have us look into community-based health center?
Sure. One of the other major providers that we originally looked at was Generations Healthcare. When I reached out to them, I found it extremely challenging to get a hold of them to start off with. And then when I finally got a hold of somebody, they really couldn't answer questions. I didn't feel like they had enough experience in school-based health centers. They only have one site currently. So I didn't feel that their knowledge was sufficient enough to be able to support us. I was looking for somebody who has experience and knowledge base, and also just somebody who was willing to work with us. So I didn't feel that that was there. The other provider was Community Health, who I started working with. I know that Department of Public Health, they do offer grants. It is a very intense process. I know that system extremely well. And it is challenging to get a grant, and you would somebody to spend a majority of their time. It takes away from the mental health services to be able to manage that grant. So if you have somebody like Community Health Services who really kind of helps to do that, your time is going to be well spent providing service rather than doing management of the service.
Okay, thank you.
Herb, you're muted.
I think I'm unmuted.
You are.
You're good now.
This is on the agenda for the next meeting for discussion purposes, and probably we can do some more investigating and discussing in depth, so we can get a real handle on this subject matter. That's so. Is it possible for you to bring in this company for discussion? Do you think?
I think we could bring them back. What I don't think Tuesday would be a reasonable time frame. So I think that, again, it may make sense to do a special meeting that's just around them, where you can ask questions, and we can gather more information that you need. I think that the more questions we have answered, the easier it is to make a decision, you know, in some direction. So that's up to the board. If you want to bring that company back and have them do a presentation and ask questions again, or what direction you want to go in.
I think I'd also like to hear from some teachers in the district about their experience. I think that that would help us better understand the need and how it impacts them. We did have a couple of summer, and some people here have been teachers or are currently teachers. So certainly some of us have experiences and things that we would contribute that way. But I think it would be interesting to see if people in other districts saw a change when they came in.
That's a good idea, Michelle.
Tracy, do you have your hand up?
Yeah, I wanted just to add to what Michelle was saying. I think that it would be helpful if teachers could, without breaking confidentiality of anyone, but just some scenarios of the kinds of behaviors and situations that are happening in schools that are prompting us to have a need for this more than we ever did 20 years ago. As an educator, I have an understanding because I see it happening all the time, but I think there might be some misunderstanding from those who went to school years ago or had school years ago about what's happening. And Phil has talked about this. I know you've talked about how the needs in our schools have increased a lot, but I don't know that we have clear examples in our heads of what that looks like without, and so maybe those teachers from other districts or whatever could share with us some of the situations that may have been improved by this kind of service, or what our teachers are looking for to have improved.
So I've heard three things so far, and I want to make sure I'm not putting words in your mouth. One is to, at some point, have this company come back and have a conversation again with them and be able to have a presentation, ask questions. Two is to hear from teachers. Three is to answer more questions, you know, about what is our specific need, what are some of those examples, what are the number of hours that, and you know, our true caseloads for the professionals that we already do have, what does that look like? And then we could easily, you know, I could contact the superintendents I know that obviously both in Stafford and Ashford, and have them put some sort of written kind of information. They've experienced this company, right, Marcia? They're in Stafford too. So we could get some information from their administrators and maybe even their parents about how's it going. I don't know if we would be able to access a parent because of the confidentiality. I don't know if they would be able to know who is receiving services. But if that would help give you some, you know, feedback from a district that's actually using this company. Any other? And can you unmute Ann? And
I would be especially interested in hearing from Ashford. Can you hear me?
yes.
Yeah.
Okay, I would be especially interested in hearing from Ashford because they're our regional partner and they're kind of K-8 like we are. So it's a very similar situation. I think Stafford would be great too, but I see Ashford as being very parallel to us. So thank you.
Donna, can you unmute Donna, please?
Well, you'd also had mentioned that there was other things. I believe you had said curriculum and things like that, and we haven't even touched on that. So I'd like to know what kind of things are happening and what's available.
Marcia, you can actually answer that with just SEL conversation we had today and kind of where you're at with that committee.
The committee has been and is continuing to really dive in and work on how we're moving forward with our SEL curriculum right now. You know, it is really being done through the advisory and through the mini lessons, but we are, and we will be coming back to the board with a little bit more information and recommendations on how we're going to enhance a social emotional learning curriculum. We're kind of in a place that a lot of districts are where we're really assessing what we have and looking at ways to increase that. So you will be definitely hearing from the committee very soon on some more recommendations for that.
Is it possible to see a sample of what this looks like?
Of a curriculum?
Mm-hmm.
Oh, absolutely. We'll come and do, you know, a presentation and really kind of lay it out for the board so you can see that.
Dr. Stein, what was it Castle? Was another
and
one?
for your Donna, there's CASEL, CASEL is the National Organization for Socio and Emotional Learning. So they have so many resources on their website. They talk to districts about how to implement SEL curriculum. They talk about, through a clearinghouse that they have, which ones have the most evidence-based and have the best research outcomes in improving student achievement and engagement. And that's all free. And then there's also a variety of evidence-based practices, and you could actually look at their curriculums right online. Like an example would be something called Second Step, which is an evidence-based curriculum that many districts in this area use. And many of their lessons are freely available online.
So, Marcia, are you working with either one of those groups?
Yeah, so actually we've been really looking at the Second Step program, and I do have some experience with that too in my previous districts. So that's one curriculum, probably our top curriculum that we are looking at right now.
There are other good ones. That's just the first one that came to mind. So
Yeah.
CASEL is the overarching umbrella organization that provides guidance on what curricula schools could use that would best meet their needs based on a variety of variables that can be assessed to be contextualized to that particular district's needs.
Thank you.
And that I think what's the thing that's important about that is when we start talking about curriculum, we're talking about all students, right? This is not a targeted. Is the Second Step have targeted lessons, or do those SEL curriculums have targeted lessons for specific students, or is it more broad everyone?
Well, universal targeted lessons, right? Sorry to repeat.
No, you go ahead.
That are age appropriate, so it, you know, expands. It's a continuum of a curriculum, so spanning through kindergarten through and up. So I don't know, Ravi, if you want to add.
I think Phil was also asking just about how does Second Step fit into the triangle of support. So Second Step is a curriculum for all students, but they do have extensions that are for what we call Tier 2 and Tier 3. That can provide more specific lessons and follow-up. And really it's about the dosage of support, how much and how often the students are able to access practicing some of those skills. But again, it's all related to what I would call wellness and like emotional intelligence and the ability to be a 21st century learner. And that's where you have the sort of continuum of health promotion, mental health promotion, and mental health support, which is the more responsive aspect of addressing problems that already exist versus preventing them, which we know is always the best avenue is to prevent a problem.
Any other board questions, comments? Can you unmute Herb? I just saw that he's muted. Sorry, Herb. There we go.
Okay. Okay, I think we've completed everything that we're going to complete this evening. I want to thank Dr. Serb for her presentation and for her help this evening. It's very informative, and we've gained a lot of information. And
Happy to be here. Thank you for inviting me.
Thank you. Marcia, thank you for helping out too. I'll make a motion to adjourn at this time. Do I hear a second?
A second.
It's moved and seconded. All those in favor signify by saying aye and raise your hand.
Aye.
Aye.
I heard Elena too.
Yes.
Perfect.
See you.
Have a
Good night,
good night, all.
everyone.
Thank you so much.
Thanks so much.
Okay,
Thank
good
you.
night. Thank you.
Night.
Good night.